Good evening, friends. I'm Dr. Ajay Shah, bringing you this another great light tonight. As you all know, we have started this new series called Femmentality. You can read it on Facebook description. Femmentality is essentially a series about women empowerment, how to make women, have equal pay as men, how to advance a woman's causes, how to make sure a woman's well-being is maintained, to make sure that women's physical health is maintained. And we have started with this Dr. Abbasi series Femmentality. And we have started the first important topic on women's mental well-being. And we talked about depression part one last weekend. We covered actually, important starting point of depression, that how common it is, what are the symptoms of depression, and who are at risk of developing depression. So today we're going to cover part two. Let me give you a quick update on our page. We have now more than 100,000 followers. We are doing this Facebook Live with Healthy Cooking with Jayshree pretty much 2-3 times a week. So please stay tuned for that. We are also on YouTube. All our videos, all our live go to YouTube within a few hours. So if you missed the live, or if you cannot finish the live, you can always go to YouTube and watch at your own convenience. So we have almost 200 videos on our YouTube channel, same name, Healthy Living with Dr. Ajay Shah. So let's bring our guest who has been gracious enough to keep coming back to educate us, educate me, educate all the women, educate pretty much everybody on our page. So welcome, Dr. Abbasi.
Thank you, Dr. Shah.
So let's dive into depression again. I think depression, like we talked about last time, very prevalent. Almost 12 to 14% of women have it. A lot more women are not diagnosed. So definitely 15, 20, 25%. So please tell us that if a woman wants to prevent depression, wants to prevent feeling down, wants to prevent feeling kind of a despair, what are some of the precautions a woman can take so that way a woman doesn't have to ever go through depression?
Okay. So definitely what we are realizing right now, that with all the treatments that we are offering, we still are managing to get at least like barely 1/3 of the population. So definitely there is more that needs to be done in the preventive realm. So first of all, I think important piece is the self-awareness, that to understand when you are clinically depressed and it's not just simple anxiety or sadness that everybody feels. When does it become a disorder? In order to do that, I would recommend there is something we call PHQ scale, which is very available if you Google it. But even if you don't do all those questions, a simple question: over the last 2 weeks, has there been more days that you have been sad than happy? That would be a huge indicator of what your depressive level is. Beside that, then to monitor is, are you happy? Are you enjoying things that you used to enjoy? What's your energy level? Are you sleeping okay? Are you eating okay? Are you feeling future oriented, or you are thinking of thoughts of like, I'm a burden and I should just no more be here? Things like that. So first of all, that is very important, to take a personal inventory. Now, when we look at the causes of clinical depression, of course, a huge factor is genetic vulnerability. So if you had depression in the family, or especially if your parents are depressed, more chances that you would be depressed. Then comes the gender, that if you are a woman, higher prevalence, possibility of you getting depressed. So knowing that, knowing your history, knowing that, what we can do is, so other factors that contribute to depression is psychosocial environment. So how was your childhood? What level are you right now at? Do you have relationship? Do you have a career? Do you have economic stability? So all those factors impact. Then comes trauma, right? Like if you have been exposed to trauma. So taking in account of all that, what we can do is, we can do away with the vulnerability that runs in the family, but definitely you can be cognizant. If you have experienced trauma, go and have grief counseling, have trauma counseling, have cognitive behavior therapy. So one thing is external way that we deal with depression. One thing is internally we develop this negative schemas that everything is hopeless, nothing is ever gonna end, nothing is ever gonna be effective. To challenge them, those negative schemas, you have to get into therapy as soon as possible. Even if you are not clinically depressed yet, those are good, healthy skills. So having therapy or interpersonal therapy, if you are having trouble with relationships, it's important. So improving your coping skills. Life will not stop happening. Life will continue to happen. But how can you improve how can you become insight oriented? How can you become solution based rather than focusing on the problem? All that learning coping skills are very important. Then we recommend having a good medical workup done. Is there any underlying health issues that are contributing? Like, diabetes can present as depression can be first sign, or there are other serious problems that can present with depression first. So having a good medical workup, checking your thyroid kind of, defines affects your moods directly. Checking your vitamin D levels, checking other nutritional deficiencies like are you anemic? Are you maybe low vitamin D contributing to your fatigue? So taking that. Then can we improve our nutritional take? Like you talk about eating healthy, eating fresh fruit, vegetables, taking omega-3. These are all protective. Then comes what else? So one thing is cognitively, you improve yourself. Then other thing is behavioral activation. What can you do to change your behavior? So exercise, having regular exercise schedules. Those are important. Then comes how can you decrease your stress level? Because what happens when we are constantly stressed, body is producing more and more cortisol, which is the stress hormone, which affects your emotional brain. So your emotional brain enlarges, become very reactive. So you are constantly reacting to things. Once you start meditating, bring your stress level down, and instead of reacting, think think calmly, coping strategies. Then your mood starts to get better. So you can do therapy, you can do behavior activation, you can take care of underlying nutritional deficiencies. If there is hormonal ups and downs happening, then go and get an OBGYN consult, or again, go to your family practitioner and figure that out. That does your mood gets affected with the hormonal fluctuation. Then another big problem in Michigan we see is seasonal affective disorder. As the weather changes, people start to get depressed because you don't see sunshine. So again, there are ways to counteract that. You can change bulbs in the house, you can get light therapy. So you will have to be really proactive about it.
And those are some excellent points. And I think, I like your first point, which was to take the inventory of how you are feeling, for all of men and women both. And I think that's where I think almost making a habit, and I learned from you just today that everybody should have a habit once a week, like you said in last session, that once a week, sit down for 15 minutes and reflect on your week. That did you have good days? How many good days did you have? Are you feeling up to your full potential? Are you feeling fully energetic? Are you sleeping all right? Are you eating all right? And maybe if you want to go to the PQRS scale, that's fine. Or at least make 10 of your own points, which you think are important to you. And, which includes sleep and eating and exercise and relationship, and see how you are performing with those points. Because if you make your own early assessment and diagnosis, you will be apt to reach out to support, reach out to medical care much quicker than wait until you fall into full-blown depression. So I agree with you. And I think some of the tools you gave us, including cognitive, including behavioral, including physical exercise, meditation. All those things are probably the way we can prevent depression. And now my next question is that if a person feels that that person, a woman, is going through depression, we talked about symptoms last session. What are some of the consequences, either social consequences, personal consequences, medical consequences, and including life-threatening consequences? What are the consequences of a person going through like mild, moderate, and severe depression?
So sadly, what we see that people who are feeling depressed, I'm sorry, I was gonna. So what we see is people who are depressed, their life expectancy shortened. So your lifespan shortens. Why? Because this constant depression, which is unchecked, ages your brain, ages you physically, but also ages your brain. So more chances of you developing more serious mental issues, but also physical health issues. You can develop cardiac risk factors, you can develop hypertension, diabetes. They all have strong underlying component of depression and anxiety. But depression can also cause inflammation, bring your immunity down. Again, going back to, instead of releasing good mood hormones, it's releasing stress hormones, which creates this constant inflammation in your body and can affect your immunity as well. So that's why we are now seeing that this can lead to serious issues like cancer. But beside that, it's not only the span of life is shortened, quality of life, healthy life is decreased. So your not only quantity shrinks, your quality of life is decreased. And you will have more disability related days. So you will have days where you are less productive. So it's not only, it affects you individually, your relationships can get affected, your career choices can get affected, but your health can get affected, but then it becomes an issue for the society as well. Your people who are close to you get affected, your families get affected, but then it's a huge burden of disability. So we are losing in billions of dollars in untreated depression.
Those are great points. I think personal level, physical health, mental health, family health, friends health, community health, our society's health, nation's health, and world's health. I think when a person is depressed, that's a big, big loss to this humanity. And I think when a woman is depressed, many times, because women is the leader in the family, in many, many families, women many times handles a lot more kids, a lot more financial, issues. Like my mom always manage our finances. I think, so when a woman is depressed, actually whole family suffers much more quicker. Not that men's depression is not important, but women's important has a lot bigger consequences on family and on the society than we can ever imagine. So those are sort of great things. So my next question to you is that if a woman is feeling down, is feeling like she's going through depression, how quickly she can reach out? Who's the first person she can reach out to? What kind of doctors she should be seeking the help from? And what other community-based programs are available, or any psychologists or anything like that, to make sure that the person gets a quick and a most effective care for the depression?
Starting with your primary care. If you see an internist, a family medical practitioner, like I told you, getting a good medical workup. So we rule out, exclude every other underlying health conditions before we move and deal with the mood. So, and then right now, the way system is set up, the referral has to come from a primary care or a family practitioner to a psychiatrist or a therapist. And initially, I would recommend first getting the medical workup done, getting into therapy. And then still, if you see that it's not improving, it's at a point, then you go and get medication help through a psychiatrist. Beside that, I think it's important to also have open communication. If you are like a youngster or adolescent living at home, it's important to have a conversation with your parents, because support in the family is extremely important. Um, be very open about it. Don't stigmatize it. Don't feel ashamed of it. Having open communication will get you more resources. And of course, the work has to be done with the families and the community to be receptive. But I think being an advocate for yourself, so go to your primary care, connect to a therapist, have these conversations with your family and friends. All that are very important initial steps to take.
No, I think those are some great suggestions. And I think I want all our listeners and actually everybody in the world to know that depression is no longer considered a taboo. Depression is a very common condition. A lot of people go through that. There are a lot of effective treatment available. And depression is not essentially means that you are just tired or you are energetic or you need a vacation or you need to do less things or you need to take it easy. Those are not the way we define depression. Depression is a real mental disorder, and it used to be a taboo. In India, it used to be a big taboo when I was in medical school. And I think now we all have realized that depression is actually a medical condition. And better we identify, better we respect it, better we get a proper care. Otherwise, depression can kind of mushroom into a major consequences. So I want to really talk today a few minutes about one of the most kind of a life-threatening consequence or complication, and that's suicidal ideations when a person has moderate or severe depression. So please tell us, who are the more of people who get those ideations, number one. Number two, when those ideations happen, what a person should do immediately, and what is the success rate in overcoming those ideations so the person never unfortunately completes the action of committing suicide.
So, Dr. Shah, I would recommend we do a complete segment on suicide. It's such a complex and detailed, it's an issue that really needs to be.
We will do it. We will do it next week. If you want to
but yes, I can. So here is what I can briefly talk about it. So at least 15% of patients diagnosed with depression attempt or complete suicide. So this is a really high number. But then given there is certain more vulnerable population, that's our younger generation. First, it used to be in older white men, we used to see almost 1 in 10 person attempting. So it was very high, but right now we are seeing in our youth, the numbers are going really up. So definitely it's a big risk. And anyone who has been diagnosed or not diagnosed can very easily escalate to the point of that hopelessness and feeling worthlessness that they can attempt or complete suicide. So the thing that we really need to understand about suicide is it can be premeditated or it can be impulsive in the moment of time. So again, that's why we are hoping from start of prevention, most important prevention with depression, we are hoping to give them some coping skills that they can bring their emotional reactivity down. So who are people who have higher risk? People who has family members who have completed suicide or attempted suicides, people who have had recent losses, people who have had friends or loved ones recently completed suicide. That's a big high risk. People who are living in are more traumatic, stressed situations. Those are at higher risk. That's why we always recommend not having accessibility to firearms. Still, firearms is the most common way people complete suicide. So no accessibility to firearms. And again, teaching them coping skills that's why it is so important to have the ability that life will happen, tragedies will happen, but how not to focus on the negative aspect of life and how continue to look at the silver lining, how continue to refocus on what positive is happening in your life and being counting your blessing and being grateful for it.
No, I think I'm glad we started talking about this thing. And next weekend when we meet for 20 minutes again, I want to dedicate 20 minutes on suicide prevention and how to get the best help and how we can prevent in every woman, every man not to get to that stage. So we'll cover that. Today we really covered important topics. To sum it up, we know that depression is common. There is a ways of preventing it. There are ways of seeking out the help. You should always start with your primary care physician to make sure there is no organic, that means there is no medical reason for feeling down or feeling depressed. So all those things are the starting points. This video will be on YouTube in few hours. Please watch it again and again and get the best medical care you deserve for every woman. When you feel down, when you feel less energy, when you feel depressed, please don't wait. Reach out for help immediately. There are a lot of professionals available in every community. Please reach out to them right away. So thank you, Dr. Abbasi. This is a great series we are starting. We'll be touching base not only on mental well-being. I think with your expertise, with your wisdom, with your hard work and energy you put in the community, you are such a source for every woman's empowerment. We will be continuing this series not only on mental disorder, but also on women and career. Minority women. We're going to be covering on parenting as a mom. We're going to be covering as a woman, as a spouse. We'll be covering a lot of different topics, not just on mental well-being. So I really look forward to next many years of doing this thing together. So thank you, Dr. Abbasi.
Thank you, Dr. Shah.